Hello, and this is Dr. GERARD CUOMO. I'm back with Oleg's case. I'm now trimming his temporary. And I'm just going to use the time now to do that while we're waiting with the retraction cord in place. Polishing all the flash, the excess stuff that's out and about around the gum tissue. And we're trying to keep our patient nice and dry right now. That's the key. So you got to stay dry. If he stays dry, we're in good shape. If he gets it wet, we'll be staying here. I'm not going to say midnight again. So we'll stay nice and dry. Alright. Now I'm going to beef up some of these margins because I can tell on a high magnification. I need to do something to make them stronger because he's going to be a while with this temporary. So I'm going to add something. I'm going to add something called flowable composite. I'm going to do that now. And just let me know when that flowable is ready. Okay. I'll bring our light down. And I'm just going to add just to the outside portion. I'm going to be careful staying away from margins. And we'll just pull that with an explorer, just kind of pull it so it grabs more of the temporary. So this is kind of like our extended version of crown prep, just for more educational purposes. And whenever you're doing these films, it does slow things down a little bit, but we want to make sure you got all the different steps here. Oh. And then we'll add to the other side similarly if we have to. There was one little pinhole right there. Got it. That should do it. I'm going to just push it in there and pull and cure it. Right, so 10 seconds you're done. So that should do it. And we'll finish polishing this with our light up. Great. Okay, now I have something to polish too. It's not such a thin little margin. You know, you don't want to neglect to beef up that margin. Now, what I'm doing is I'm getting rid of this layer that doesn't set on the inside, called that air inhibited layer, where some of that material is just a little slimy. You know, get it out of there, clean it. You can take alcohol and do it too. I like to squirt because it makes the cements stick a little bit better. So there you have it. Now you just go ahead and take a yellow cup that we used before, and we're going to polish those margins down. Protect those margins with your thumb. And come around the contact, stay below the contact area. This is the distal. I could tell the shape of the margin. Round it as you come around the lingual. Right? And he's going to be feeling this with his tongue, so you got to make sure it's baby smooth. I've got to go talk to a patient with TMJ problems, but we want to get the impression going before I take off, so we will be finishing Oleg up with cementing this temporary. Yep. I'm just taking all the excess off. It really does help to use like a rubber wheel of some type. This Russell cup is good. I got the bristle brushes next. I just use a normal bristle. Double checking to make sure. Sometimes these things, when you autoclave them, they turn a little brown on you, but this one looks good. There we go. There's that lingual. We'll work a little harder on that. There's your contact area on the distal, contact area on the mesial. We'll pop that back in. And Oleg is saying, let's go, let's get it done so I can get home. Right, Oleg? Oleg's going to watch this on YouTube. I don't know if he's going to be up to it tonight, but you can always watch it. It'll be on there embedded as long as we want to keep it up. You don't have to watch the whole thing in one setting. There we go. I like to really hone in the interproximal area. So important. You know, you want that tissue to be nice and pink. It was red today. We're lucky we're going to get this impression. And that's what the crown's going to do. It's going to make all that better. It's the contours, the glassiness of the ceramic. Should do quite well. There we go. That's the mesial contact area. I can't emphasize the fact that these temporaries are the key. If you're not spending the time with your temps, you're really missing an important step in dentistry. So I do teach a course over at FAU, and we're going to be covering this semester how to polish temporary. And these are pre-dental students that will be doing it, and some of which have no dental experience whatsoever, but when we're finished with the course, they'll understand why it's so important to have a temporary, and hopefully they'll take that with them to dental school. All right. From what I understand, the requirements at Nova are one full crown, but a lot done in the sim lab, so all the more important that they need to understand crown preparation and design and making temporary. So this is going to go in there after we get the impression. So first things first, let's get that cord out. We got our impression material ready. We'll put it over here first. Oleg, we got a 6-minute impression coming up. Let's get your first cord out. Let's see if we do need to change that. No, we don't. That's going to stay just right. Look how nice and dry that is. Now, you can just literally take, follow me closely here, just literally take cotton plier and just gently, see that's the one that's under. We want the top portion, I think that's over here. So yeah, we just pull that gently. And just gently, 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 all the way around. We don't want any bleeding, so just go real slow and gently, just like that. Now, off we go to inject, starting it now, and we'll do a little bit back here, a little bit right there, and then drop it in, stay in there, come all the way around, stay in there, come all the way around, stay in there, bring some up here toward the occlusal, don't forget these other teeth there is important. Then take your air syringe and just blow it in a little bit, not too hard, just a little, just displace it. You don't want to create a lot of issues with air getting caught underneath. So just go gently, ever so gently, just like that. And now we'll go right back in place. Now, so you know, there's a chance of getting a little tiny bubble somewhere. But if you do this, just like this, whether it's 1 tooth or 14 teeth, you should have a nice result. Here comes our, and close all the way down, all the way, all the way, all the way. Stay closed. Perfect. And just show you where we are here. And he's closed all the way down beautifully. 6 minutes to go. We'll take a look at that impression when I come back to you on the next almost final step here. Take care, Dr. Jerry Cuomo and Boca Raton. Back after talking to my TMJ. Okay.